Hello, everyone, and welcome to my Let's Talk series where we talk about topics related to raising multilinguals abroad and intercultural communication. Now, today I have the great honor and pleasure to interview Dr. Alessia Raineri. Alessia is a linguist from the University of Zurich, which is also my alma mater, where I studied and worked also at the same department where you did your PhD, Alessia. Il mondo è piccolo. And she specialized in multilingual acquisition and dyslexia. The title of her thesis is in Italian, Un bambino multilingue, studio longitudinale sull'acquisizione dell'italiano, del neerlandese e del francese di un bambino dislessico a contatto con più di 3 lingue dalla nascita. And for those who don't understand Italian, just the same in English, a multilingual child, longitudinal study on the acquisition of Italian, Dutch, and French in a dyslexic child in contact with more than 3 languages from birth. Alessia is a guest professor at the Zhejiang University Technology of Hangzhou, I hope I pronounced it right, and a certified teacher of Italian as second or foreign language and a translator of children's books. In the past 23 years, she has lived in 8 countries. She and her family are still on the move, but currently based in the southwest of France. In 2022, Alessia founded Multilingual Land, a consultancy company that helps parents to raise happy and confident multilingual children and supports schools to make them thrive. She is a mother of 3 multilingual children that are aged now 11, 9, and 5, growing up with French, Italian, Dutch, English, and some Chinese. Now, Alessia, I'm very happy to have you here on screen and that you can share all your knowledge and your insights with us today.
Thank you.
Yeah, you're welcome. You wrote your dissertation on the topic of a multilingual child, a longitudinal study, like I just mentioned, on the acquisition of Italian, Dutch, and French of a dyslexic child. And it's a research study about the language development of your son, who, by the way, was exposed to, I think, 5 languages during the first 3.5 years of his life. So can you please tell us a little bit more about your research?
Yes, of course. My PhD thesis is about a case study. So my eldest son grew up with several languages in the first years of his life. My elder son, he was born in Switzerland, in the German part of Switzerland, and he has been exposed to Italian from the mother, from me, Dutch from the father, German, Swiss German from the environment, and English, he overheard it from the parents. That happened until he was 2.5 years old. After that, we moved to France when he was 2 and 6 months. Since then, of course, he started to lose some German, Swiss German, and he had this new language, French, to acquire. So my research explores all the factors that facilitate and hinder multilingual development, considering all the language involved. Of course, my research is just for a child, for a case study, but includes different interesting topics in just one case study. One of that is language attrition and language loss. It's about his attrition of German, and that he finally lost very, very fast. After he was diagnosed with dyslexia later on, 7 years old. So we reanalyzed all the data set, thinking about to look for first sign of dyslexia in the first years of his life. And he had also some sign of developmental language disorders. And at the end of the study, he suffered from repetitive middle ear infections that later on became frequent. And he was, when he was 6 years old, he was operated from the adenoids because of that. So it's a really complex case study.
Yes, absolutely. And although I would be also interested about this middle ear infections that happen very often in young children. I am one case of them, but we can dedicate another interview to that. But you mentioned developmental language disorders. Now, I know that many parents who happen to have to deal with this and to understand what this means, not only parents, but also teachers and other practitioners. What are now the aspects and insights about raising a child with multiple languages and DLD? I'm going to say the abbreviation just for reasons of brevity, that parents and professionals who work with our children should be aware of. So DLD and dyslexia, how can we recognize them?
Yes. First of all, it's there are two distinct conditions. So while dyslexia is a learning disability, it's basically a neurobiological disorder that includes some phonological deficit. DLD, developmental language disorder, is more like a language deficit. So it involves language, spoken language, and also written language in a broad sense, while dyslexia is more about decoding language. So it's more about writing and reading. It's more a learning. If we can say that dyslexia is a learning disorder and DLD is more like a language disorder, in a broad sense. So it's difficult in the first years to recognize if it's DLD or dyslexia, because sometimes we can have the first sign of dyslexia, we can recognize them in the beginning of a child life, but there are a lot of symptoms that they co-occur in both disorders. So it's a complex thing to just recognize them in the beginning of their life. The truth is that they are recognizable and really they can be assessed when the child is around 6-7 years old. So when the child really starts to, when the acquisition should be complete, and when the child starts to write and read in the school.
Mm-hmm. Yes, I understand, but and I was a little bit surprised, to be honest, when I saw that your son was diagnosed with dyslexia, or they recognized that this was going on at age 7, because in some countries, or I know from some speech and language therapists, that you can see early signs of dyslexia already earlier. So in children between 2 and 5-ish, 6, 7, of course, years old. Can you tell us more what maybe the first signs can be?
Mm-hmm. Yeah. The first signs that we see, like in a child that can have one of these disorders, is for sure to see that the child is developing late vocabulary. So around the age of 2 years old, it doesn't have a lot of words. It doesn't start to make sentences, like simple 2-word sentences. So these are already signs that the child has some little troubles with language. And when after between 2 and 3, you can really see when he's starting to speak that he has difficulties in memorizing words, especially long words, or maybe he mix up sounds, so he make his own words, which sometimes it's also typical from little children. So it's very difficult to understand if he's really on the norm or outside the norm. That was really complex even for me when I was analyzing the data. And other things, for example, is repeating words, long words. And another thing is that instead of using verbs, those children, they use more onomatopoeias. So they use sounds. And you see that they keep using sounds because it's easier for them than to use the verb. So also this frequency of onomatopoeias is another sign of having this kind of disorder.
Yeah, but when talking about onomatopoeia, I mean, there is a phase of language acquisition where the children use mainly onomatopoeia because they are not able yet to really articulate the longer words. So if you say, if the child is using onomatopoeia, what kind of age group are we talking about? I know it depends always on the different setting and the child and the individual situation, but very roughly saying?
Yeah, let's say around 3 years old, when the child still uses too many onomatopoeias. It's not really on the average.
Yeah. So onomatopoeias where maybe there would be words, monosyllables that could replace the onomatopoeia, and the child could be maybe easily or would have the age to articulate them already, right?
Yeah.
And I was thinking about something else, because what about songs? I mean, do you see a difference in learning songs or repeating rhymes in a child that has dyslexia or is dyslexic?
Yeah. Dyslexic child has difficulties with the rhyme and with memorizing also string of words, but also sentences. So it's very difficult for a dyslexic child to memorize a song, to memorize the rhythm, and to repeat like a poem as well. Like when my child was 6 years old and he started to learn poems, because in France really they make a lot of memorization of poems.
Yes.
I remember every 2 weeks he had to memorize a poem. It was hyper difficult. He couldn't do it. So I helped him like with a little drawing that he could memorize the image instead of the word. And little by little, he memorized the poem, but it was very hard. He was very frustrated about that as well.
And I imagine that you observed this not only in the school language or the community language, but also in the other languages that your son was exposed to, right?
Yeah.
So
yeah, it's very important. It's very important, in fact, to I didn't mention it before, but when you analyze a child's disorder, you can see it in all its languages. So, of course, maybe there is a more dominant language. So we normally focus in the dominant language when we analyze, because it's easier, because not all the speech therapists, they know all the languages of your child. It's normal. So it's important really to see if the disorder is in just, for example, the weaker language, but not in the stronger language, then there is no problem. There is no case of dyslexia, because the disorder should be in all the languages.
Yes, to some extent, right? So depending on how competent or proficient the child is at that stage or in that phase where the assessment or the observation is done, is in the different languages. Very good, thank you. And yeah, you said that it's not easy also to see if the child is affected by DLD, because there is so much going on during those developmental years, the first developmental years, especially in a multilingual child. So you never know really what to focus on. But you did that, and maybe also in part also in a retrospective way. But I would like now to focus on what kind of methodologies did you use in your study? Because I think it's for those who follow us and who are linguists and experts, or who would just like to know what they maybe could do when observing their own children and trying to capture some developmental steps in their language development.
Yes. In my study, we use 3 different ways of data gathering. One is the research diary, my diary, about first words. So I was really writing down the first words, when he said, why, etc., until he was 2 years old. And after, I was writing down also about some highlights about comprehension, production, multilingualism, the first kind of the first time he had some multilingual awareness, and so on. So that was one way to gather data. But the other 2 most important one are that we were recording making video recording of his language in his development of Dutch, Italian, and French. And we did it obviously with interaction with the caregiver. So for Dutch, there was the father talking to him. For Italian was me. And for French, there was the babysitter. It was possible, of course, until he went to school, because then there was no a reference for French. It was much more tricky to see his development with French. But we did this video recording for 1.5 years. So we recorded every month 15 minutes for each language, with a total of 12 hours of video recording. I transcribed all the recording, which was a very, very long and extenuating job, especially because I'm not very fluent in Dutch. So it was especially complex for Dutch to recognize his words, because also children at this age, they don't speak clearly. So you have to understand really what he was saying, maybe ask the father. And it was a very, very difficult job. And the third way of data gathering was using the communicative development inventories from MacArthur and Bates that are very well known in the research. They are basically some parenting questionnaires that we give to the parents of a child that is developing languages. Normally, they're used for monolingual children. So they use it also in the speech therapy. They give this test, these questionnaires, and the parents write down which word he comprehend, which word he produce, and also the first grammar. So what about the kind of sentences he make, and so on. And we did it as well every other month, not every month, for Italian, Dutch, and French. So we analyze also vocabulary and syntax through these communicative development inventories, adaptations in each language. And it was very interesting to have all this data set, because so we could also compare the questionnaires to the natural speech. And we found out that, in fact, these questionnaires are really telling you the truth. They say things like they are in the real life. So that was also the important finding that we had, because it was the first time we used this CDI, they're called, in a multilingual case study. Because normally they're used for bilingual children or monolingual children, but not really trilingual children.
It has been a very long work for you.
Yeah.
I know it's gathering the things, and it's even more difficult. I mean, I don't know now. Yeah, especially with the first child, maybe you can do it, but then when you have 2 or 3 children, it becomes more and more complicated, right? So it's great that you could do this with the first child.
But I did also write the first words of my other 2 children. So I really gathered the data. I could do even more research about that, because you see how 3 different children that are raised in the same kind of condition. Of course, the age of the child and the fact that it's the second one, the third, changes a lot in the family dynamic of interaction and input and so on. But it's very interesting to see how the 3 children, they develop vocabulary in really totally different ways in the first 2 years of life in the same family. So, and
yes,
this just to say how, sorry, Ute, but another part of my thesis is to underline the importance of analyzing the child aspect, so the characteristics of the child. And for me, that is very important. As a mother of 3, I also see it's clear that every child brings something different to the language acquisition, even though they have the same kind of condition.
Yes. So it has to do with all kind of aspects, the character, but also their individual preferences. And I saw that also in my daughters, who are twins, so they are even closer, some people say, but I would say not, that they had very different language developments, although being exposed to the same kind of setting. But yes, language acquisition does never happen in a bubble. So there are multiple factors and aspects to consider, and you mentioned a few, and I would like to dig a little bit deeper. Can you please tell us a little bit more about the important interplay between the family, so the parents and siblings, but also, you know, among the siblings, maybe, as we are just touching this aspect as well, and the community and the individual person, so the individual personal development and way.
Yeah. In fact, you touched 3 points that are basically the one that I'm touching in my thesis. So family, environment, and the child characteristics are 3 important, let's say, area of the language development of a child in this condition. So the family has a central role in all of that, as we know. Studies show really that the family can really manipulate the environment of a child. So that's why also we exist, we language consultants, because we help families to kind of help the children with the language, with the multilingual acquisition, because family is really making the difference. And through language constellation, parental discourse styles, or language policy, contact variety, input, quality and quantity, they are all directly linked to the family. So the family can really deal with all those factors. But it's really important also to consider in the family there are some siblings. So most of the studies are analyzing multilingual or bilingual acquisition. They study the firstborn child. Why that? Because it's the simplest thing.
Yes.
We don't consider siblings. We just consider the parents, the environment, etc. But the truth is, what about if you are a second child, third child, fourth child? Language dynamics change a lot with siblings. Let's say, in my case, for example, my firstborn, Enea, when he was 2 years and 3 months, he had his first brother. Which language did he speak with him? Of course, we were also curious as the parents, which language would he speak with the brother? Because we cannot kind of decide, is the language choice from Enea to decide which language to speak with the brother. In fact, he started to speak Italian and sometimes Dutch. So that also reveals that his strongest languages in the first 3-4 years of life were really the home languages, Dutch and Italian. Of course, because he had to move, he stayed a lot with the father, then with me. So we stayed a lot at home in that period. And the funny thing is that he spoke Italian and Dutch, and especially Italian, through the years, until he was 6 years old, even when his brother was 4, and they were going together to the school. So normally when the child goes to the school, the community languages became more important, and the siblings, they normally they switch language to the language of the community. But in this case, Enea kept speaking Italian and Dutch with his brother because he thought that the brother didn't understand French.
Okay.
I don't know why. Then when he was 4 years old, I think he started to see, but actually he's in the French school, he understands also French. And they switch, and now they speak French together all the time. And with the third child, you know, my third one, she was born when Enea was 6, and the other one was 4, so they started to speak French together. Since the first day, they spoke French to her. Even though I was really trying to plan it and to say, please make an effort, speak Italian to them or Dutch, they didn't do it. So those are factors that you cannot really do much about it.
No, we cannot really. We can direct them somehow or suggest that they use a certain language, but or create opportunities for them to use the language, but in the end, it's their choice. And I think now, counting back, you also had children during the pandemic, right? There, probably also the exposure to the community language was a little bit less than usual, or I don't know.
Yes, of course. We had 3 months and a half of confinement, so they didn't go to school in 3 months for 3 months and a half. When exactly my eldest one was 6, he started the primary school, and the smallest one was 4. So it's really the time where they kept speaking Italian, and then they went back to school and they started to speak French. After, another thing about siblings is also the quantity of input. The parents give much more quantity of input to the first child. Of course, when a second one come along, or even the third one, you have less time to dedicate to each child in general. So also the input the second child or the third child gets is totally different. Thinking also about the dynamic of the family. For example, when I had my daughter, the last one, I was much more with her all the time, in the evening especially, than my husband, because my husband was taking care of the 2 oldest ones, because he needed to put them to bed, to read the story. And me, I was doing the same with my little one. So my little one didn't have access to Dutch in the same way the first 2 had. And in fact, she didn't speak Dutch until she was 2.5, when my husband and we decided, to move things and to say, maybe you should spend more time with your daughter in the evening. But it's just life, it's sometimes...
Yeah, no, absolutely. Now, in your study, like you mentioned just now a little bit, but in your study, you focus on the vocabulary and also on the syntax, right?
Yeah.
Can you maybe share what insights you gained with regards to the development of the vocabulary and the syntax of dyslexic children and or children with DLD?
Yes. During my study, development of vocabulary was very, very slow in the beginning. So it was outside the norm, the monolingual norm. I could analyze it, and the innate vocabulary in each language was developing much slower than the monolingual children of the same age. But then it catch up. So around 2.5, 3 years old, then it started to be on the norm. When I say norm, it's always the monolingual norm. And he was, of course, at the lower limits of the reference of the monolingual norm, because the range of the norm is very large. And he was at the lower limit, but he was anyway in the norm. So we can say that at the end of the study, Enea didn't have a language delay. He developed 3 languages in a normal way, let's say, even though it was dyslexic and maybe had some sign of developmental language disorders. So that is a great news, because also there is a lot of misunderstanding about dyslexia language development in multilingual children. So I don't say most of the people, but a lot of people think that if you're dyslexic, then having a lot of languages make your life even more complicated. But the truth is, you can anyway transmit language to a child and raise a child with multiple languages, even though he has dyslexia or developmental language disorders, because it doesn't change much. He will have anyway those disorders, even if he was growing up with 1 language. So the fact that you as a family are using more languages and you want to raise your child multilingually doesn't have to stop you from having like the idea, okay, he has some language delay, so I should stop. Because as we know, Ute, you know also better than me, speech therapists, they still advise today to stop to speak maybe a minority language, because the child would have a smoother way to develop the community language. And
yes, absolutely. I mean, I must say also that the speech and language therapists that work with multilinguals are learning more and more and getting more aware of what really to focus on. And I think also when we talk about developmental disorder, there is a wider spectrum. I mean, there are children who are also barely verbal, and maybe for those there are different kind of solutions than for verbal multilinguals. So maybe we need to separate or nuance a little bit this kind of approach. But in the end, yes, to me it seems that this advice or this suggestion, I dare not to say that it is advice because they should know better, but that this suggestion comes from a place where they see that the parents are just overwhelmed by the situation, and then they say, okay, if you diminish the languages, if you reduce the languages, it will be easier. But there are many other reasons not to do this. It is the language that you share with the child, the primary language that you chose to speak with your child, to interact with your child. There are emotional reasons and many more. But yes, what you say about speech and language therapists, and I would like to maybe focus on that in a moment as well, or even now, we can decide for ourselves what parents should look out for if they appoint a language therapist, or what a language therapist should actually be focusing on.
Yeah. You touched an important point, in fact, because to understand also which are the causes of slow language development, you have also to analyze the situation in an holistic way. So to understand the situation, you need to know the language, the linguistic biography, for example, where the child, when the child starts to be in contact with this or that language. You cannot just analyze the community language of a child if you know that he just started school before he never spoke the community language. So you have to get an idea of which is the dominant language in that child, the linguistic biography, and also to know more about the input. How did he get the input from this or that parents for this or that language? Because sometimes it's also about the input. If there is not enough quality and quantity of input in a minority language, of course the child can have some language difficulties to develop that language, so some language delay. So it's very important to have the whole spectrum of the situation and to analyze it. I mean, a speech therapist needs to be prepared, needs to be trained. And not all of them, they are trained, because obviously they were trained in their language and in a monolingual country. Like in France, they are trained in a monolingual school where they have to be trained for French. So they don't have the specific training for what to do with multilingual children. So it's something also you need to know as a parent when you go to speech therapist. Ask first to the speech therapist, are you trained for multilingual children? Because it's not so evident. And if they are not trained, maybe you can ask to a language consultant like Ute or I to really analyze the whole situation and to give you really some right advice of where to go, which kind of speech therapist, if you need it really, and so on. Or maybe to just have support on this language that sometimes is the minority language. You need some support to develop it faster. So you need also some expert that they tell you what to do, how to approach communication, what to do when you are interacting with your child, and so on.
Yes, how to foster speaking in different contexts, and then also consider the fact that some of the children go through transition, and so they are still adjusting to the new language, or whatever reason is behind their not being in the norm, or however struggling with some aspects about language development or so. So I really appreciate your holistic approach in this, because it's since I do this and help families, I see we need that more and more. So collaboration not only between teachers and parents, but also with speech and language therapists that know how to support all the languages a child has, and they can reach out to the parents if they don't know the language. They can reach out to other speech and language therapists around the world. There are organizations and directories that you can consult. It's really only a click away sometimes. I mean, of course, you need to talk more about the details. That takes time, but still, it is feasible. It's not something that is rocket science, although for some rocket science is really easy, but you know what I mean. But anyways, yes. So what you were saying is what professionals and parents would need to know about the dyslexic children and children with DLD. You just mentioned it now, that they are aware that it can it usually affects all the languages to some extent, and that they have to look for speech and language therapists that cover, in the ideal case, all the languages. But I just talked with a local international speech and language therapist. Fact is that depending on where you live, those speech and language therapists who are specialized in multiple languages come maybe from abroad, and they are not covered by the health insurance, which is something that very often blocks then some families to go ahead. And so then focus only on the community or the most dominant language, leaving aside the home languages. But I think we can maybe say a little bit more about this and say, how can we actually support, or where can parents of children with DLD or dyslexic children find that support, if not immediately around the place where they live? And there is also very long, at least here in the Netherlands, a very long waiting list, up to 2 years, to get the help that you need. So
yeah, depends for sure of the country where you live, but yeah, basically be aware about the fact that also dyslexia is not caused by being multilingual, but it's just a problem itself that you have, a disorder that you have, because it's genetic, it's biological. And sometimes also I see parents that they come to me and they say after years they were in the school, nobody tells them that that the child can be dyslexic. But then I analyze the situation and I think it may be dyslexic. They go to analyze it and they find out that there is dyslexia, in fact. But why it happens that? Because a lot of teachers, they think because the child is multilingual, so automatically he will have some problem in reading and writing because he misses vocabulary, he doesn't have the same comprehension, he can comprehend the text like the others, so he has some difficulties reading and writing and so on. And they associate that explicitly to the multilingualism and not to the fact that maybe there is something behind that. It also happened to me personally that I went to the school when he was in primary, at the end of the primary school, and the teacher tells me, you know, it's a little bit slow to read and to write. I know you speak a lot of languages and so on. And me, because I'm doing research on that, I explained to her, look, I know that he may have some dyslexia. It's also, his father is dyslexic. I know it can be genetic. It can be transmitted from the family. So I suggested her that probably was dyslexia. And I went immediately to the speech therapist to make an assessment. But I see that the approach of the teachers, it's really to think that you have a child that speaks another language at home. So those difficulties come from that.
Yeah, it's easy to blame the languages, right? It's the first thing that comes into mind, because there is still this monolingual norm. It's very difficult to get over it, or to shift towards a more multilingual norm. It will take...
I want to say something about the monolingual norm, because it's in fact one of the subjects I touch in my research. There is this monolingual norm that we, as researchers, we need to check, to follow, because there is not a multilingual norm. So it's basically, it's understandable why, because if a child speaks 3-4 languages, we cannot find the norm on children that speak the same 4 languages. So there are starting to be some bilingual norms on homogeneous large group of children. For example, Spanish, English, bilingual norms. And now in the Basque countries close to me, they are doing the French Basque and Spanish Basque bilingual norms. So it starts to be like something they are starting to do, because in fact you cannot compare a pear with an apple. That's it. You cannot compare a monolingual child to a trilingual child. So the norm has to be also understood, and you have to think that it's also kind of normal to be in a lower range of the monolingual norm, because you are dealing with 3 languages or 4 maybe. So
yeah, but in order to establish some kind of norm, you need to focus on the consistencies in a rather homogenic group. Whereas talking about multilinguals and maybe even mobile multilinguals, it's all over the place. I mean, there is nothing that is really consistent, or that is consistent for a longer period of time, that then will allow to draft some kind of norm. You can also only indicate tendencies or probabilities, but this doesn't help parents or professionals, obviously. But that is a great development, that at least in more stable bilingual or multilingual societies or circumstances, conditions, they are starting now to draft something that is more towards a bilingual norm kind of thing. At least
I know, for example, in the thinking about trilingual norms, I remember a study that in the studies we talk about mean utterance, mean length utterance. Did I say right? Yeah. Mean length utterance, that is the kind of the length of the sentence that the child say. It gives you an idea of the language development is having. So they found out that trilingual children, they have more or less the same mean length utterance, and which is a little bit shorter than the monolingual child, because a multilingual child, in fact, it's making shorter sentences than a monolingual child in general, in the norm. Of course, after you have a very talkative trilingual child that they make complex sentences, and another one they make shorter sentences, but we're speaking about the average. And the average, you have to think also in the multilingual children, they normally speak in a way clear, but shorter. It's also because they are more efficient communicator. They speak different language, and they understand that it's about being concise and communicative. So they don't make long sentences as the monolingual child. But once you understand why, you understand that it's not about not having a developed language, but it's about they are using several languages at the same time. So it's also a smarter thing for them to do that.
Yeah, it's smarter, and it's also more economic, right? In that given context. Why?
Efficient.
Yeah, more efficient, right to the point, focusing on what is really important to get the message across. And all this that are also part of the multilingual advantages that have been highlighted by many researchers. So it all comes together and it reconfirms each other. Yes. No, absolutely. So we were mentioning before also the fact that maybe in different countries you find very different kind of support, right? Do we want to talk about this for a moment? I know that you dedicate a bit in your thesis as well, and we talked about this also online or offline. And maybe we can also invite those who are following us or who are going to watch the recordings to participate a bit in gathering information about this all over the world, because I know that for us or for my clients, when they move from one place to the other, and maybe they are starting an assessment of a dyslexic child, and then it's all done again from case one in the new place. It takes time, they lose time. what families can actually expect from different countries or different settings?
Actually, I can speak well about France because it's where my children grew up. They are scholarized, and I know better, much better than Switzerland, because my children were too small when I was there. Italy, I know a little bit because I come from Italy, and I think it's very similar to France, also Italy. So when the parents have troubles, or they think that the child has troubles with language, they go to a speech therapist. Here, there are many, many speech therapists. You have a waiting list, but it's not so long because there are many, many speech therapists, and also they are paid. You get reimbursed by the insurance, so you don't spend so much for that. And there are many, many. So that's the positive point. The negative point is that not many are prepared for bilingual children, multilingual children in general. So you need to ask, to be direct, and otherwise to go and to get analyzed from other kind of professional, like a language consultant, that they are expert on the topic. But at the end, when you get assessed, you can show it the assessment to the school. And the school, at least in France and in Italy, they make it's called the Plan d'accompagnement personnalisé, PAP. That is a special document where they actually assure you that the teachers will facilitate the child through the scholarization. So they give a special assessment, special exercises. For example, I know that in France they do they dictate words every week. So children need to memorize words, and of course for my eldest child this has been always his nightmare day, because he needs to memorize words, and then they tell the words, or they tell some sentences with this word inside, and he needs to write them down. For him, they make it specially with just a clause, like a gap where he needs to write the word. So he doesn't have to write all the sentence, but he writes only the word that he needs to memorize. So it's kind of facilitation for children with dyslexia, but also for the assessment or for other kind of exercises. And I know this happens also in Italy. They have something similar.
Yeah, here in the Netherlands, if I can share, usually, well, children from birth up to when they are 4 years old, they are taken care of by the Centrum Jeugd en Gezin, and there is an assessment around age 2 to see how the child is developing, not only the language, but also overall development of the child. And even later, let's say when the children start speaking more around age 2, right, we have this explosion in vocabulary, etc. Tendentially. When parents observe that maybe the child is not repeating the words of a song or of a nursery rhyme or something, or they struggle with understanding, they can actually detect it early on and then refer them to a speech and language therapist. Everything after age 4, the children are taken care of by the general practitioner, and you need a referral from the general practitioner to find a speech and language therapist. Some studios have speech and language therapists in-house, so they can refer them to them directly. But as I said before, there are sometimes waiting lists up to 2 years. So it's actually suggested to, whenever you doubt that there is something going on, also for the sake of the parents' nerves and energy and everything that is involved, because, I mean, you worry, go a little bit earlier and just make sure that you check if there is anything going on. And the local schools work also with speech and language therapists. They're logopedist. Yeah, and orthophonist in France, right? Logopedist in the Netherlands. And some international schools have also in-house speech and language therapists, or that they work together with them, but very often then they cover the school language. Let's say it's an English speaking school, then it would be English plus maybe another language. And as I said before, it's not necessarily covered by the health insurance. So this is another step to take and to be aware of. And this is also why many families that I know here that need a speech and language therapist go to Belgium, for example, or to Germany, depending on what languages are involved, to get the therapy that the children need. And this with regards to everything that can happen. But it would be nice now to know also by those who follow us or who watch the recordings to please share how it is in the place that you live. Maybe you have experienced it, in order to help also other families have an insight and be aware of what to expect should they move to the country that you are living, or should they encounter these challenges with their children whilst living there and whilst exposing the child to multiple languages. So that would be very nice, and it would be a nice way also to continue the conversation. I would like to refer you all to the YouTube channel, not on Facebook and LinkedIn, because that way we can focus on one social media platform only. That makes our life a little bit easier, right, Alessia?
Yes.
Yes.
So perfectly understandable.
Yes, absolutely. Is there anything else you would like to add, or you would like to advise parents or direct them to?
Well, let me think about. You need at a certain point you need to be coached, because when your child is having some issues in language development, you kind of, because I lived on myself as a mother and as a researcher. I felt like my child, when he was 2 or 1, in this period where he was acquiring language, that it was difficult for him to memorize. I remember some words that just stick in his mind for years. He couldn't change it, even though we were repeating the right word. That sticks. So it's very hard when you have, I know, through living it, it's very hard when you have a child that you really feel he has difficulties to acquire language, to just not give up, because you could just give up. But in fact, he had issues in all the languages. So, and for us, it was a natural way to live. We both speak different language from the place we live. We speak English together most of the time. We use English for work. So it was also a dynamic that we couldn't break so easily. So and I felt like the child needed more support. So what I try to give also is more time with him, speaking Italian, to make his Italian stronger. And, in this kind of cases, for example, I also studied in my research the way the parents answer to language mixing, which he was doing, of course, many, many times. And there is this famous continuum of Lanza that say, you have to use this strategy or that strategy to create a monolingual context with a child. But of course, with him was kind of difficult, because you needed to interrupt him a lot of times. So you didn't want us to break the flow of the conversation. And so what I discovered is, in fact, what we did is my husband actually used a lot the move on. So move on strategy is the one that you let the child speak, even though it's making mistakes. Sometimes it was also code switching. My husband was using some words that the child was using, instead of telling him this is the right word in Dutch. So, but me, I was a bit more strict, and I was less moving on, but a little bit really concentrating on modeling his language, on correcting his Italian through examples, making questions, reading books, creating more vocabulary, making him repeat maybe with the questions. I was not like literally telling him, what did you say? But maybe I was asking another question so he could speak, so we could concentrate. Sometimes I remember some part of my thesis where I concentrate on grammar, that he was making all the same mistakes, like the accords with adjective and noun that we have in Italian. That's a little bit tricky. He was not really understanding that. And through example, through speaking, he got it. So a way also you speak and you interact with a child that has difficulties is slightly different from having an interaction with a child that doesn't have any issue. And I understood it also from my experience, because after I had 2 other children that they don't have any language difficulties. So that's why you need to be coached as a parent, be coached in what to do, and to give them to give to the parents the tools necessary to communicate in this kind of situation, to support the language, because they need to be supported, those parents. Once you have the speech therapist, she does it for the community language, which is important, but it's easier because you have somebody external doing it. But you need also to be trained to do it yourself with your minority language, because nobody is doing it for you.
No, absolutely. And I think this is a very, very important point that also some speech and language therapists I work with, I mean, they see maybe the child for half an hour, maybe an hour a week,
Exactly.
but the child needs constant support in the other languages as well, and that at home. And this is why it's so important for parents to be aware about what they have to bring to the table. That it consists in a lot of work, but I mean, at some point the children will roll by themselves, so it will fall into place, and you will learn also alongside the child. It's not something where you say, oh my gosh, it's so difficult. It's not less difficult if you drop a language, because the child will struggle with the language that is left. And there will be other effects on your relationship maybe with the child, but I don't want to go there. But the language we can help our children best with is the one that we use with the child. But the patience that you mentioned, I mean, it was transparent for me that we need a lot of patience and also knowledge about what to do and how to do it, and not taking personally when a child is repeating over and over the same word, which is not the one that they should be using, and to be, as you said, coached or accompanied during this journey by a professional, by someone who can tell you, okay, your child is doing this now. This is actually moving towards something. Because what I observe very often is that you are so into this role of parent trying to help your child. Maybe you have other 2 children or more, and it seems that you are not moving. It's not changing much, but in the end it's good to have also a perspective from the outside, from someone who knows what they're doing, to tell you, no, actually you are moving, it is changing, and it's improving.
Exactly.
Absolutely. No, so
if I can add something, also because when you don't have the diagnosis, you don't have the assessment, you just wonder, is it my child dyslexic, is my child having DLD? It's a difficult moment, and you feel frustrated as a parent, because you think like you are giving the best, the quality input and so on. You're all day long with him and speaking and showing books, etc. But so you have this frustration that once you have the assessment, you know, okay, that was the problem. Already you feel less frustrated, because you know you were doing the best, but you cannot do like impossible things. So in this kind of period, when the parents start to see language delay, some difficulties, I would suggest to go to speak with a language consultant or a speech therapist that is trained for that, and to go and speak about it, because in that period you need support. In that period, before having the real assessment, you need support. You need to go through this with the right tools. I feel like I should say that.
Yes, I would like to leave it like that, because it's a nice ending. So if you're looking for someone who really knows about this topic, please go and contact Alessia Raineri. We have shared the different links in the descriptions on Facebook, LinkedIn, and on YouTube as well. And we will share maybe more information there as well, so that if you come back and maybe rewatch some parts of this interview, you can find more information. Thank you very, very much, Alessia, for your time and for your knowledge and for sharing all your insights that you gained, not only through your study, but really firsthand, and for the great dissertation that you wrote. I read it and I can't wait to see it published, to be honest. whether in Italian or English. I know I suggested in English, but well, it could be translated. But thank you.
Thank you very much, Ute, for inviting me here to speak about my research, because it's in Italian, as you say, so it's not possible to read it for everybody. And thank you most of all to read it, because there are not many people that read it until the end, which is a little bit a big thing to read. So thank you very much for this opportunity.
Thank you. Bye, everyone. Thank you for following us today and for watching maybe the recordings. Let's continue the conversation in the comments on YouTube. Bye-bye. Till next time.
Thank you.